Good morning, or good afternoon, depending upon where you are. This is a special edition of Facebook Live right here on blackdoctor.org. And so before I tell you about why we're here at noon Eastern, 9 a.m. on the West Coast, what we like to do is there's a couple things I need for you to do for me. Number one, in the comment section, let us know where you're watching from. So I like to see where your zip code, your area code, rep your area, rep your city, put it in the comment section. I like to see where people are watching us from all over the world. Number two, if you think somebody could watch this, could use this information, tag them, tag a friend, share it. We don't like to hold information, especially good news that we can use. We like to share with our friends and family, so tag a friend. And also, if you have any questions about what we're going to be talking about today, please make sure you drop that question in the comment section so we can get your questions answered, because we're all about information here, and we want you to have the right information to be able to share it with your friends and family and for yourself. So that's all the particulars. So we're here today to talk about something that when I say it, all right, I want you to brace yourself. Research, right? And so we're here to talk about, this is the All of Us research project. And so what is research? We hear that a lot, and now especially since we've been year 3 of the pandemic, everybody's doing their own research, right? All right, we got those buzzwords out of the way, but what we're really talking about is research that you can use in order to have better health outcomes. And so that type of research is vitally important, but you have to engage. And so we got some great guests here to talk about the All of Us research program, what you can do to engage, and how you can improve your overall health outcomes, not only for yourself, but for your community. And by your community, I mean our community, and that's Black and brown people. So you didn't sign on today and give up your lunch hour to hear me yap. So I'm going to bring on our special guest. So first of all, we have Elizabeth Hamilton. She is from the Mary Center. Elizabeth, welcome to the program. How are you?
Thank you so much for having me. I am well. I'm well.
And second, we have Larissa Gilmer, and she is going to be explaining to us what is the All of Us program is all about, give you some information, and then we're going to answer some questions to kind of talk about what this whole deal is, get some real facts, and answer your questions at the end. So I'll turn it over to you, Larissa.
Thank you. Thank you so much for having me. I'm so glad to be a part of the conversation today. So Ellis, we're going to go ahead and jump right in, if you don't mind.
Yep. You're good to go.
All righty. So my name is Larissa Gilmer, and I am with the All of Us Research Program. And I'd like to thank the Mary Center, Grapevine Health, and Black Doctor organizations for allowing me to be here with you today. And of course, I want to thank all of you for joining us to talk about something that is so very important, improving the future of health. Today, we're going to discuss the importance of addressing health disparities that are affecting many groups, in particular, the African American Black community, and how the All of Us research program is working to close those gaps. Next slide. I joined this initiative because it gives me the opportunity to help my family and future generations. As an African American woman with friends and family affected by cancers, high blood pressure, endometriosis, fibroids, and infertility, I recognize the importance of diversity, better health care, and prevention for our communities. This is why sharing this information is very important. We know that these challenges impact us, the Black community, and we have the power to make that change, but it's going to take all of us. Next slide. So we're going to have a quick show of hands. Who would like their medical providers to give solutions that are specific to you as an individual? Great. I see many hands going up. I figured you would, and so do I. Next slide. So the first step is to understand the concept of health research. Research is the process of finding out new things. Health research is the process of finding out new things about improving people's health care. Did you know that the majority of health research has been conducted with a middle-aged Caucasian man as a participant? Well, that means that the medicine that research is designed specifically for older white males. So that means if you're not a white male, then the medicine that you're taking may not be the best for your body. Going forward, we need to do a better job of including everyone in health research. The only way that we can fix this injustice is with your help. The All of Us Research Program is on a mission to help change health research to represent our our country's diversity. All of Us is the largest and most inclusive health research program ever. And we're collecting health data from over 1 million people in an effort to help researchers learn more about health. Next slide. So, what is the All of Us Research Program? That is a great question. All of Us is a large program led by the National Institutes of Health that's working to improve healthcare through research. Unlike research studies that focus on one disease or one group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. It is a longitudinal effort to gather data from at least 1 million people or more who reflect the diversity of the United States. In order to accelerate health research and medical breakthroughs to enable individualized prevention, treatment, and care for all of us. All of Us is a part of the Precision Medicine Initiative, which launched in 2015 under the Obama administration. Next slide. So we know that we're all different, right? Of course. But when we go to the doctor, our treatments are often the same. And that's not fair. Your healthcare and treatment should be tailored just for you. This is called precision medicine. Precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that a one-size-fits-all approach to medicine isn't the best, but because we know that what works to treat me may not be able to treat you. Each person is different, and we're going to talk about 3 things or 3 factors that impact our health greatly. So the first is being genetics. The second one we're going to click, and that is we're talking about lifestyle. And then our third one that's going to show up on the screen is our environment. Ultimately, precision medicine can produce more accurate diagnoses, earlier detection, and better prevention strategies and treatment choices. Next slide. Okay, now give me a thumbs up if you know someone who wears prescription glasses. Okay, I see a few hands. About 14 million people in America aged 12 and older have self-reported visual impairment, which is defined as 20/50 or worse. We know that prescription glasses are common, and if you don't wear them yourself, I'm sure that you know someone who does. But in actuality, we may not realize that that is precision medicine. Here in the background, you can see a collage that represents how someone with 20/40 vision would view it. However, apply prescription glasses, aka precision medicine, and it goes from 20/40. Do you mind clicking, Dr. Ellis? And it goes from 20/40 to 20/20. You see, what works for one person might not always work for another. That is why most people have different vision prescriptions. And as you saw here, a custom solution was created for the individual's needs. And in times like these, health research feels especially important. But to get there, researchers need more data. Some communities, including the African American Black community, have not been invited to take part into research, or they were invited but not told what was all that was involved. This has contributed to the lack of trust and general hesitation in participation. And for these reasons, very little information is available about the Black community regarding research. African Americans represent 13.4% of the United States population, yet only 5% have participated in clinical trials. The All of Us research program has learned from this history and want to make sure that things are done right. We will tell you what we are doing, share results, and protect your data so that many different groups of people can join. All of Us is crucial to helping better understand the factors that drive these health disparities. For example, we can discover answers to why African American adults are 60% more likely than non-Hispanic white adults to have been diagnosed by a physician with diabetes. All of Us is our chance to diversify the research pool by changing statistics and be included in the cure. Next slide. All of us participants are from different races and ethnicities, age groups, and regions of the country. They're also diverse in gender identity, sexual orientation, and health status. Did you know that 80% of the All of Us participants are from communities historically underrepresented in research? And over 50% are of racial and ethnic minorities. So why is this important? So by studying data from a diverse group of people, researchers can learn more about what makes people within our community sick or what keeps us healthy. Next slide. Safeguarding your identity and data to the best of anyone's abilities is our most important responsibility. We take privacy and security very seriously. It's at a top priority of our program. We use the latest technology to help keep your data private and safe. Identifiable information like your name are stripped away from your samples, and you are assigned a unique code. When the research does begin, researchers sign an affidavit saying that they will not try to find out who you are. Survey and all personal information are kept safe on an encrypted server with limited access. We hire a third-party agency to continuously try to hack into our system and keep it safe. Now, how about that? The program even has certificates of confidentiality from the government. We aim to minimize all risks to ensure your privacy and security are safe. And always remember that participation is voluntary, so you are free to share as much or as little as you feel comfortable. I chose to become a participant in the program because I felt that my information was safe and secure, and I liked that I could access my data at any time. Next slide. So I know you're probably wondering, why should I join? Well, I'll tell you. By joining the program, you will help represent our community in important studies that may lead to new research findings, treatments, and cures. Secondly, you'll be able to learn about your own health, including risk factors that are specific to your family history or community. Thirdly, you will be able to learn additional information about research opportunities, such as clinical trials that may be relevant to you. And lastly, you'll be able to leave a legacy for your children, grandchildren, and future generations by supporting potential breakthroughs in areas of cancer, diabetes, heart disease, dementia, depression, and chronic pain. Next slide. So how can you get started? Well, that's a great question. There are actually two ways to join. You can visit the All of Us website at joinallofus.org/connect, and there you can learn more about the program or choose to sign up if you're ready today. Or you can download the All of Us Research app in the Google Play Store or Apple App Stores. You may notice that there are two All of Us apps in your App Store, but please be sure to download the one named All of Us Research with the all-white background, created by Care Evolution. Next slide. Once you've created your account, you will go through, you will be asked to give your consent. So this includes reviewing a series of videos, which will provide you more detailed information about the program. These describe all types of information that you may be asked to give. Once you feel comfortable that you know what to expect, and if you are ready to give your consent, you electronically sign the consent form. You can do all of this from your computer, tablet, smartphone, or a partner center. You may also elect to share your electronic health records, which is a digital version of your medical chart, and complete the consent to get DNA results. You will also may be asked to answer several health surveys. In combination with other health information, the answers provided in these surveys can help researchers identify patterns in how our lifestyle and background affect our health. After these initial steps, you may be asked to share your physical measurements and provide your biosamples so that the program can help researchers better understand how different factors, including our genetics, makes our participants unique. Next slide. And before we wrap up today's presentation, I want to invite everyone to get out your phones and open up your camera. The QR code will take you right to our website, www.joinallofus.org/connect, where you can continue learning more. I'd like to thank you all for your time, and I hope you enjoy learning about the All of Us research program. All of Us is delivering one of the largest, richest biomedical data sets that is broadly available and secure. Together, we can make a difference in speeding up research and improving the health of our communities. Don't miss out on your chance to help change the future of health for all of us. Thank you, and I'll pass it back to you, Ellis.
Well, thank you so much for that wonderful presentation about the All of Us research program. So I'm going to give the Cliff Notes version of what we got, and then we're going to talk a little bit more about what's going on with all of us. First of all, I think some of what we're talking about is it is really an a la carte participation in research, right? So you can answer some surveys, you can, if you want to give some samples, but you don't have to. So you get to choose how much you engage, right? And so that's number one. So that really is different than any other type of research program, is that you get to choose. There's various methodologies and way you can engage, and then you get to choose how much you want to engage. So that's one beautiful thing about this program. The second thing is, what I love about it is convenient, right? It's got an app. So it's not somebody calling you, blowing you up all the time, just asking you for stuff. Email boxes full. No, you can engage because it's got an app, and we all know that these things. And I learned this a long time ago. People leave their house with three things: their keys, their wallet, and their phone. So those are the top three things. And so if you have this with you, you're always. So this gives you more control over what happens. And so those are two like kind of just big things that jumped out at me from that. Not to mention the other added benefit of being able to add to a body of knowledge that's going to improve health outcomes for our community. And so that's where I'm going to stop and jump off. And so I ask you again, Larissa, how did you get involved with all of us? I saw you had nice glasses. I saw the picture, looking all good, sexy and all that. But what was going on? How did you really get involved? What attracted you to become part of the All of Us?
Well, honestly, I can only speak from the program perspective, and I wanted to leave a legacy for my son. So I wanted to be involved because I wanted to, be a part of history and to be a part of health research, to find out more about myself so that I can inform my children and my children to come.
Absolutely. So I think, one of those big things, we know that when we hear research, genetics, those are buzzwords, and we hear those words, and then when you're Black in this country, you immediately say Tuskegee. It's like a word association. You research genetics, Tuskegee, it goes together. So how do we differentiate this All of Us program from that despicable event that happened in the Tuskegee syphilis study? You may be some lag there. So I'm going to really try to help dispel some of the myths regarding to the Tuskegee study. So one of the biggest misconceptions about this study is that the people were given the participants were given syphilis. That is not the case. Treatment was withheld from people that presented with syphilis, right? And so what they did was they kept them in this program, and they just continued to study them, even after a suitable treatment was found. Penicillin was discovered as a treatment for syphilis, I believe, in the 60s. The study started in 1932 when there wasn't a suitable treatment. So they just kept it, and they studied the people, the non-consenting participants, and they told them that they were treating them for syphilis, but they really weren't. They were just withholding treatment to watch the course of the illness. And so that's the number one misconception, is they feel like that people gave them syphilis. That's not the case. They just withheld the information. It's still despicable, but not as diabolical as actually injecting someone with the disease. And then over time, and then they just kept telling them that they were treating them, and they really weren't. They were watching what happened. So that's what happened there. How do we get our community? So Larissa, I'm hoping, how do we get our community to kind of set that, not forget, because I'm not a fan of forgetting, but I'm saying, how do we get them to trust that this research program is not going to misuse their information if they submit it?
Definitely. Well, first of all, this is not, the All of Us research program is not a clinical trial. So I know that in the Black community, we are like, oh, clinical trials, we don't want to be involved. All of Us research program is just a database of information. So you are, if you choose to, if you feel comfortable to, you are just sharing your electronic health records or answering health surveys that pertain to you, just to be put in this database, so that when researchers are ready to go into this pool of information, that they will have data from our Black community to pull from. So again, it's not, research, clinical trials. It is just a database of information. So like I said in the presentation, your privacy is the most important things to us. So once you give us this information, like I said, and you can share as much and as little as possible as you feel comfortable with. So again, you let us know how far you want to get into this, how much information you want to share, and it's totally up to you. So that is how, we can kind of dispel some of that things, and just to know there's policies and procedures out here of what is going to be done with your research and what is not. I hope that answers your question.
It does. It answers my question perfectly. And I would say, I would just add to that, is that if we want better health outcomes, we have to engage, right? We have to acknowledge what has happened in past transgressions, like Tuskegee, like Henrietta Lacks, like the kind of generational distrust that our communities have with healthcare. We have to acknowledge that, and we're acknowledging that here today. But we also have to engage, because if we want to have better health outcomes, we cannot disengage and then get mad that we don't have great outcomes. We do have to engage to some extent in order to be able to get better medications for our community, because we understand that there's a different type of interactions that medications have with our bodies. In order to be able to have more culturally competent healthcare professionals. And the only way they become more culturally competent is to give them the data that they need in order to understand that Black patients do better on this medication versus that one. The only way they can do that is we have enough Black participants in this database, in this research program, in order to help all of the healthcare providers say, oh, you know what? Okay, we've got to recommend something different for this patient group, whether it's old, whether it's female, whether it's Black, brown, or otherwise. We have to have that data in order to be able to make a better recommendation for that. Because I know the one that I love, I wrote this down, precision medicine, right? And it was part of your presentation. So we want to be precise, you got to give them the information. So I'm going to pivot real quick and bring in Elizabeth to this conversation. Elizabeth, you are at Mary Center. Talk to us, what is Mary Center, and how did you all get involved with All of Us research?
Yes. So thanks again, Dr. Ellis, for having me. And I'm so glad to be part of this really important conversation. Mary Center is a community health center in the DC area. So we have 3 clinics in DC, 1 in PG County, Maryland, and 1 in Montgomery County, Maryland as well. And we serve over 60,000 people a year. And of those 60,000 people, 93% of them are folks who are part of the African American, Black, or Latino community. Mm-hmm. And so we wanted to be part of this All of Us research initiative because we recognize how important and valuable it is that with working with our patients, we want to give them a voice. We want to give them the opportunity to be part of making decisions on research that's going to impact them and their families. So we saw All of Us research, we saw their values, and we thought, oh my goodness, this is perfect. This is exactly what we're looking for because Mary Center, we value empowering our patients and making sure that we create transparency around research that we also engage in and participate with. So we thought this would be a great opportunity.
Absolutely. And so how do you all share information with all of us, and how does that information exchange happen?
Yes. So we understand here at Mary Center that there are different ways that we can communicate with our patients. As you said, what are those 3 things that are vital? Can't leave your house without? So that cell phone is one of them. So we like to send communications out via emails, and we realize that not everyone uses emails. So we're also exploring ways to text information to our patients also. We have a secured platform called a patient portal where our patients can access all of their medical record information. So we also communicate things about the All of Us research program through the patient's portal account as well. And we also have a whole team dedicated to individuals who will walk our patients through step by step to get enrolled with the All of Us research program. And if at any point in time, if one of our patients had any questions, we have an email that they can communicate with us and also a phone number.
Well, that's good. It sounds like you got all the bases covered there. And what has been some of the feedback that you've gotten from the people that have been engaged, that you all have engaged in the All of Us program?
We have been really pleasantly surprised to hear that our patients are really excited that this is an opportunity that allows them to be part of this conversation and be able to join something that allows them to share as much or as little information that they would like. And I think that was one thing that they really valued is how much of my information do I need to give versus what I want to give? And how is this information going to be used? And so that has been one of the key feedback that we've heard from our patients.
And I think that speaks to that acknowledgement, right? So we understand
Yes.
that the acknowledgement is coming from, we recognize from past transgressions that when we give information, it can be used against us, right? And in the past, it has been used against us as a people. And so we become very supremely guarded about sharing our information. And we should be. I mean, today's society, when we talk about identity theft, we got all this stuff going on, especially around the internet. But let's call it what it is. If you're buying shoes and clothes and shirts and all of that on the internet, your information is out there, right? It's out there. So let's not try to separate this and make it something that it's not. This is part of it. And Larissa did a great job of talking about they got people trying to hack their system. I was like, wait, what? Y'all got professional hackers trying to get into the system. And I think that's very important because you understand this is your medical information. Safety and security is of utmost importance. So Larissa, bringing it back to you, what can somebody expect if they went to that website, join allofus.org/connect? If they go to the site, what can somebody expect when they go and they engage with All of Us?
Yes. Well, they're definitely going to find, when I'm talking to people about the program, I definitely tell them to really do their research and find learning more. You know what I mean? So again, it tells you about, again, they have frequently asked questions. And I think that is probably one of the most important pieces of the website, because it goes down to any question that you can think of. It goes down to, again, with the privacy. It goes down to, am I eligible? So as long as you are 18 years and older, so that's an important piece, 18 years and older, and you live anywhere in the U.S., in the country, you are able to participate in the program. So you're going to find a plethora of information that you needed. But of course, I think for me, the most important part is going to those frequently asked questions and figuring out, to make sure that this is something that you really want to be a part of, and we have testimonials. So again, there's so much information on the All of Us website. There are videos that people can learn more to be able to connect with the All of Us research program.
Well, as you know, Elizabeth, it's funny how there's a wealth of information. You all are sending emails, and we've got the app and stuff like that. But as Black folks, let's just keep it 100 here. And that's the reason why Grapevine Health is in existence. And that's why it got the name Grapevine. We like to share information person to person, So what would you encourage somebody, if someone was to ask you about All of Us? What would you tell them? Because they may not go and look at the facts page, even though Larissa's explained it's there. It's on the site. I'm gonna ask my cousin, I'm gonna ask my mama, I'm gonna ask my sister, what you think about this program? So Elizabeth, what would you tell somebody that asked you about All of Us?
I would say All of Us program allows you to have a voice at the table. As Larissa explained, it is so important that you as a Black woman, myself, as a person of color, it's important to be able to give feedback on what decisions are made about health that affect our bodies, and that will affect our children and generations to come. And so it's not just, don't think about clinical trials, think about what information you are willing to share that is going to be important to change the way folks of color are able to receive services and also have access to new treatments. Treatments that may not be as effective for us right now could be even better because we're participating in this All of Us. So it's just an opportunity to give your opinion on things, to share information about yourself and your family history. And it's really important that we join it to help inform how we can improve our health outcomes.
Well, you got me sold. But I would say this, that, in all seriousness, one of the biggest challenges that healthcare providers face today is when you go and you're sitting in the waiting room, and especially when you go to a new doctor and they give you that clipboard and it's got all those things you have to fill out, right? So you're giving up your information, health information is protected, and nobody fills out that family history. And what's vitally important to you having an individualized health outcome is by giving your healthcare provider the most information, including that family history. And so I would say, number one, if you don't know your family history on any of these, especially the major ailments that are impacting Black and brown communities, find out. Ask your mom, ask your aunt, ask your grandmother if they're still around. Ask them if they had any ailments, if you know anybody in the family had any ailments on both sides. So that's number one. Number two, once you get that information, have it in a safe, secure place and disclose it to your healthcare provider, because you could be doing something. We had a recent incident, a recent Facebook Live with a gentleman that had a family history of diabetes. They didn't talk about it. And then he had a dizzy spell. The nurse checked him. His blood sugar was off the charts. So he had uncontrolled diabetes. They were treating the diabetes, but did not check, because if some medications with diabetes could impact your liver health. So he went from having the diabetes treatment impacting his liver health to the point to where he had to get a transplant. And all of this, from the diabetes to the chronic kidney disease, could have been impacted if he had just disclosed, hey, if he knew, because he didn't know he had a family history of diabetes, if he knew that, maybe he would have been checking his blood sugar on a more regular basis and watching what he ate and his diet and things like that to keep his blood sugar down. And then he would have known, the doctors would have known, hey, there's a family history of chronic kidney disease. So maybe these medications aren't the best to treat this particular patient because that could exacerbate any potential kidney issues. So, that domino effect that can happen when we're not disclosing medical information can have a profound impact on your outcomes. So that's what all of us is about. It's about improving health outcomes. So, Larissa, let's bring it back to you. What would you recommend? And I think I know the answer, but I'm going to answer. I'm going to ask the question anyway, and I'm going to ask why. Would you recommend the All of Us program to your family member, friend, and if so, why?
Yes. So definitely, I would definitely encourage people to join the All of Us research program. Again, like I stated before, it is like Elizabeth said, so we can have a voice, so we can have a seat at the table, so we can leave a legacy for our children and our grandchildren. It's just important just to, and you'll be able to find out information that you may not have known about yourself through the All of Us research programs. And again, you'll be able to help in being a part of medical breakthroughs. So I definitely would encourage people to be a part, my family, my friends, to be a part of the All of Us research program, because it's definitely important.
Absolutely. Absolutely. So, yeah, I just put in the comment section. So if you're watching us, you're just joining us, we're talking to Larissa Gilmer from representative from All of Us research program. We're also talking to Elizabeth Hamilton from the Mary Center in the DMV. She said PG earlier. That's Prince George's. We got people watching us from New York and all of Katy, Texas, and all that stuff. But you said PG, like we all know about what's happening in the DMV like that. Okay, everything's not about the DMV. All right, so that's Prince George's County. Those of you that don't know what PG County is in the district area there, but we are, in all seriousness, we are talking about something that's very, very. It's a new kind of topic and concept, but it's really important in terms of improving health outcomes. So, we here at BlackDoctor.org are all about improving health outcomes for Black and Brown people. We know about the life expectancy gap. We're trying, one of our goals is to close that gap. And the way we close that gap is by having more culturally competent healthcare. And that includes better medications that have been researched on Black and Brown people. And so if we're not participating in the clinical trials, part of the reason why the COVID-19 vaccines are effective across the board, young and old, is because there was a significant number of Black and Brown people that participated in those clinical trials. But as we learned today, that's not what the All of Us research program is. This is about adding your information to a database of knowledge so healthcare providers can be better equipped to be able to answer the questions and prescribe the right medications, the right treatment plans for anybody that comes into their office, and not just, as Larissa talked about in the presentation, old white men. Okay. And so that's really what we're here to do. So we do have a question from Megan. Is the program available in any other languages? Larissa, is the program available in any other languages besides English in America?
Yes, it is. It is available in English and in Spanish.
Okay. So yes, so that's a great question, Megan. It is available in English and in Spanish. So any other questions from our audience, please make sure you drop them in the comment section. As you can see, we'll answer them as they're coming in. So ultimately, and I know, again, I think the point needs to be reiterated. This is not a clinical trial, right? So what happened with COVID, that was a clinical trial where they put you in a study. They give you some different doses of medication. That's not what this is about. This is about gathering research and getting enough body of research on particular groups, right? So we're amassing it for multiple groups. We're talking about people of different sexual orientation, people of different races, genders, all of these different subgroups and classifications. We put them all into a database, and then we can from that database, we can extract, oh, health outcomes improves for this group when we do use this type of medication versus this type of medication. And all that research and all that data can help improve overall health outcomes. But there's that word again, engagement. So Elizabeth, how do we get people to engage more into these type of programs?
Yeah, one of the things, Dr. Ellis, that I would say is transparency. Wanting to share information with the community as much as possible so that community members are informed and they can be empowered to make the decision that is best for them. I think All of Us does this really well. If you do go to their website, you will see really great information about what the program entails and how your information is protected, as Larissa did a great job explaining. And I think that those are the types of details that when we share those up front and we're forthcoming with how we're using the information, how it will help the community, that transparency will empower our community to be involved and be engaged.
Right. I had a quick flashback when you said, up front, I was thinking about something my mother used to say when we were going to the store. And she would always say, look, don't ask for nothing. You ain't about to get nothing. And she was saying that she had the saying, I'm gonna tell you up front so it won't stick out behind. It's an old Southern kind of statement, but really it's really about, we're gonna tell you everything up front. So therefore you're not gonna get down the road and have something happen that you weren't advised of, right? And so that's really important when we're talking about sharing our own personal medical information, health information. We want people to be confident and comfortable that their information is going to be held in great confidence, secure, and not be used against them at a later date. And so I think that transparency, that was a perfect word to describe this, is that the transparency is very, very key. Larissa, did you have anything you wanted to add on that response?
No, that was great. Again, I will add one thing, that even if people get to a point where they join and they want to withdraw, they can do that as well. So they'll just have to go to the website and just tell there's a process that, if you want to withdraw, you can withdraw at any time. So it's not something that you're held to. So it's, easy to be a part of, but it's also easy to withdraw if you feel comfortable.
Well, that's good to know, right? So you have control. It's basically, this sounds like informed consent, right? We're telling you up front, as Elizabeth said, we're going to tell you up front and we're going to give you all information. We're going to be transparent, right? In terms of what's going to happen throughout this whole process. And at any given time, you've got the get out of jail free card, like for those Monopoly players back in the day, right? So if you just don't feel if you don't feel comfortable anymore, you don't feel like sharing anymore, you want to get out of the program, you can get out. You're not trapped in for life. You're not trapped in for any specific amount of time. And you can share as much as you want. So if you want to donate some information, you can. If not, if you just want to give them access to your medical records, and that's it, that's all you can do. So you can choose and you can level up as much as you want. And so I think the more control that individuals have over their information and their involvement, the more comfortable they can be in terms of getting involved in this, all of us. So how close are you all to reaching that goal? Because I know the goal was 1 million. How close are you to reaching that goal? Or have you reached it? Have you surpassed it? Where are we in that process?
We have not reached that goal yet. I can find out that numbers. I do not want to give you any incorrect information.
It's ongoing. It's changing.
Yes, it's always changing. It's always changing. But I will definitely be able to get you that number so we can share with everyone.
I would just say this: join. Right. We need as many Black and brown representatives in this database as possible. The more we can get in there, we have to engage, right? I'm keep saying that word this entire program. We have to engage, because that way we have better health outcomes. You cannot, and Elizabeth and I were talking about this before you go on the air. If you want to make an omelet, you got to provide some of the ingredients, right? You can't sit back and just put a pan on. We need eggs, we need ham, cheese, some peppers, some onions, all of that to make a good omelet. So we can't complain about the outcome of the omelet when we haven't put in the ingredients, right? And so the same thing can be said about your healthcare outcomes. You've got to give them your health information. You've got to talk about your family history. You've got to talk about, give feedback on medications that have been prescribed to you, right? If you don't give your doctor feedback, oh, this made me constipated, this made me gassy, if you don't give them that feedback, they're not going to know. They won't be able to say, African American female. I've had multiple African American women say this particular medication, gave them this particular ailment, this particular side effect. Now you can say maybe there's another option. But if you don't get that information, they're just going to be like, this is number one, right? Here, take this one. And so now, again, you want a better omelet, get better ingredients. So got some great feedback. Oh, I guess somebody from all of us watching. So the program has over 460,000 participants enrolled, right? So the goal is 1 million, as stated on the website. So the goal could be higher than that, but I saw this on the website. Goal is 1,460,000. So you're just under 50% there. So it's up to you all, right? It's up to all of us, right? Just like the name suggests, it's up to all of us to get involved and become a part of this. So thank you, Jamila, for saying that. I'm gonna put that on screen because we're going to encourage you all. And as you can see, scrolling along the bottom of the screen, it has the information on the website. And I also put that in the comment section. So you just have to click. You don't even have to type it in. Just click in the comment section and you can go directly to join. Again, join today. Join today. And then later on, if you say, you know what, I'm not really comfortable with that, you can always de-enroll. But join today. Get your information. Put your voice in. You can't complain about not being heard if you're not speaking. All right. So, Elizabeth, tell us some more about the Mary Center and what could you all be doing? Is there anything that we could be doing better in order to get more participation in all of us?
Yeah, so Mary Center, as I shared, it is a community health center. So we provide medical, behavioral health, dental, and different programs that we offer to the community at large. And so just in that alone, we also provide educational services as well through our partner, Berea Public Charter School. So just through that work alone of all of these services that we offer, there is so much to learn of how receiving these different services make an impact on that magic word, Dr. Ellis, health outcomes. And so what we can do better at Mary Center is what we always do right now, but what we can always improve upon is better reaching out to our communities and speaking with them directly about efforts like these.
Right.
And I will do a little bit of a shine for Mary Center.
Okay.
A good example of something that we're doing right now, we established a patient advisory group. So we have a group of our patients who receive different types of services, who join these meetings, and they talk to us about like what you were talking about, Dr. Ellis, about, treatments and services and things that don't really work well for them and how we can change and what are some things that we can do to better improve their experience. And so that is an example of an effort that Mary Center is doing to try to better engage and to better understand from our communities what we can do to bridge that gap, what we can do to raise more awareness on really important efforts like the All of Us research program.
Well, I'm just excited and encouraged by what's happening here, right? So, first of all, I'm just really excited to be part of this and to help share this with our audience at Black Doctor about the All of Us program. Please, I encourage you, all of us, no pun intended, to join, right? All of us to join so we can be heard. I love the idea that you have a patient advisory council, right? That the patients can speak up and have a voice, right? Because this is about inclusion, but you've got to be in. That's the first two letters of the word inclusion. You got to be in to be included. And so the number one thing is if we get patients to have a voice, they're going to feel more empowered. They're going to be more adherent. That's another key word to the treatment plans that are given and that are provided, because the treatment plans are going to be better, right? They're going to be more suited and they're going to have better outcomes when there's a treatment plan that is, what you say, Larissa? Precision medicine, right? So we're going to create precision medicine treatment plans for precise outcomes and better outcomes to close that life expectancy gap. One of the things, one of our hosts that we had on Black doctor, she had this saying that would say, we're trying to improve your health span, right? So we all have a lifespan. We don't know how long that's going to be. Lord willing, it's going to be a long and fruitful life. But we also have a health span. And that is the number of healthy years that we have in our lifespan. And so these type of programs, signing up to be part of the All of Us Research Program will help improve that health span, so you could have more healthy years in your life to be able to enjoy your life and live it out more abundantly. So I'm going to ask if there are any more questions. Do we have anything? And I'm going to ask, we're going to start with Elizabeth to kind of sign off, to kind of give your final thoughts with regards to the All of Us program and the program that we had here today.
Yeah, sure. Any other questions, Dr. Ellis, before I give my
No, I'm done with my questions.
Okay. Yes. Well, I think we summed it up here today. I think really and truly, you got to join. It's so important that we capture your voice and that you are seated at the table to be part of decisions that are being made. These decisions are being made with or without your voice. And we just want your voice to be captured. So joining the All of Us Research Program will ensure that not only just for you and your family, but for many others in this country who look like you, who look like me, who look like Dr. Ellis, can have treatment, precise treatment and care that's given to them, and that will help improve their health outcomes.
Absolutely. Larissa?
Yes, I will have to end with knowledge is power, definitely in our community. So I would definitely say, you guys, it's constantly scrolling, the joinallofus.org/connect. Go to that site, learn more, get knowledgeable about everything that we do. Of course, I spoke about it in the presentation, but again, go to those frequently asked questions.
Mm-hmm.
I am so sure that it's going to answer any questions or, prevent any more hesitation. Consent is the key. So you are able to, if you're interested and you say you want to do this, you give us the consent. If you don't, it's fine. And if you decide again, if you want to get involved in the program, if you want to withdraw, it's just as easy. But again, I'm going to leave you with knowledge is power. Learn more at the joinallofus.org/connect.
Absolutely. Finally, I would say is this: there is a shift is happening in America today across all spaces. The shift in healthcare is that the patients are becoming more empowered, as they should be, to have more control over their health outcomes. We as Black and Brown people have to become part of that shift. We cannot no longer accept the healthcare community just telling us what we need to know about our health outcomes and just telling us what they're going to do in order to improve our health. We have to become involved. We have to become empowered. And the way we do that is by, one, learning more about the health conditions, about ourselves, about our family history. The more we can learn, and that's why we have blackdoctor.org. You go to our website, you can learn about any other health conditions that we have listed there available. So you have to learn more. You have to become more knowledgeable. Number two, you have to become engaged. I've been saying that this whole program. You have to engage. All of us has given a perfect platform for you to become engaged, not only individually, but as a community. And so when we have the more people, we can help push them over that 1 million person mark. Now we have that engagement, and they have to listen. The more voices join together, the stronger they become, and the more they will listen to us. And so I encourage all of you all to not only join All of Us, but really lean into your community and go to community centers like Mary's Center and other community healthcare centers. Use your voice to improve your outcomes. I want to thank you all. Thank all of us. Thank the Mary Center, and also thank Great for Help for being a part of this program. We'd like to have you back to see it once you cross over that 750,000. Let's bring it back, and we're going to have these conversations ongoing in the future. So thank you all for spending your lunch or your morning breakfast with us, depending on where you are in the country. Thank you all, and we will see you next time.